Hi everyone, Wound Doc here. Thank you so much for joining me. If you're new here, my name is Cassandra, a wound doctor and family medicine physician. Whether you're a healthcare provider or a caregiver or someone who just wants to learn more about wound care, I'm glad you're here. Before we get started, a big thank you to all of my subscribers. Your support means the world to me. And if you're new and if you haven't subscribed yet, please feel free to hit that button and make sure that you're notified for all the most up-to-date videos. So today I want to talk about something that affects millions of people around the world: pressure injuries, also known as bed sores or pressure ulcers. But before we dive into details, I'd like to share a personal story. Back in my residency, I encountered a wound care experience that really changed my thoughts about the field. It was a pressure injury unlike anything else that I saw before that time. The depth, the level of pain that the patient was in was eye-opening to say the least. And because of that experience, it really sparked a fire as far as learning more about wound care and really becoming passionate about sharing wound care tips to others. So hopefully I can pass along some of those tips to you and they'll be helpful in some way. So just a quick note before we begin. This advice is general medical advice and really shouldn't be used as replacement for advice from your personal medical provider. I would always seek the help and input of your medical provider for personal medical issues. So what are pressure injuries? Well, pressure injuries, also known as pressure ulcers or bed sores, are injuries to the skin and underlying tissue, generally caused by pressure to the area, prolonged pressure to the area. You could also see shearing or friction forces that cause it. In my experience, I normally see them in relatively common locations like the hips, the heels, and your sacrum region, which is around the lowest part of your back, just above the tailbone. But you can also see them in the back, on the back of the head, the ears, anywhere that has a particularly bony surface or less cushion to the area, generally where the bones are closer to the skin. In my experience, I've noticed that people who are bedridden or have limited mobility, they tend to be at more risk for developing these injuries. However, I've also seen, in general, people who have experienced an increased consistent level of pressure to certain areas. So things like casts that don't fit properly, oxygen tubing that goes over the ears and it rubs against the ears and pressure is applied for a long period of time. Really, in any scenario where the patient is at risk for developing a really long period of pressure in a certain place. And what I found really surprising is that pressure injuries can develop in as little as 2 hours after the pressure source is applied. So it's just something to really keep in mind if you are caring for someone who is at risk for any of these, or if you personally are experiencing these situations. Pressure injuries are a very common healthcare issue, and they can lead to so many unfortunate consequences, like increased hospital stay, just a decreased quality of life, ability to physically function by yourself, and even increased death. There are studies that show that pressure injuries can increase your risk of dying 3.6 times more than the average population, not to mention the emotional toll that it has on caregivers and patients. So now that we've talked about why pressure injuries are such a big deal, let's talk about the stages. Just really being able to identify the early stages is crucial to make sure these pressure injuries don't get worse. Just early treatment is really crucial. So starting off with stage 1 pressure injuries. At this stage, the skin looks discolored, usually red, but can be other colors like maroon. And when you push down and you apply pressure to the area, it doesn't turn white, what we call blanchable. This might not be picked up on darker skin though, so I tend to use other senses, like whether the air is warmer than other parts of the body, whether it feels different, like boggier, a little firmer. These qualities can really also help us in figuring out whether there's any level of injury compared to the rest of the skin. At this stage, the skin is still intact, hasn't broken yet. For stage 2 pressure injuries, you start noticing a blister or an open sore. If the skin breaks open, you usually see a very shallow open sore. This means that the more superficial areas of the tissue are damaged and the deeper layers are not as much, at least not yet. Next, we have stage 3 pressure injuries. Now, with these injuries, you have deeper, more exposed tissue, and at this stage, you start seeing different tissue structures like fat. So you might notice a yellowish discoloration at the base of the wound. You might also notice some tunneling underneath the skin. Then you have stage 4. This is the most severe level. We're now seeing muscle and bone. So the wound is very deep, so you might see some dead tissue, which can look dark in appearance, very hard, or softer in texture. And finally, you have the unstageable level of a pressure injury. At this kind of stage, the wound is completely covered with dead tissue, so it's really hard to see the extent and the depth to how far the injury goes. So with these injuries, I really tend to keep a close eye on them and just keep them as stable as possible while the wound heals. Now, how about prevention? When it comes to prevention, I tend to generally follow a few key tips. The first one being regular repositioning. You know, the studies are still not quite out as far as fully supporting this, and it really depends on the type of injury and the person's condition. But all in all, I feel like, and based on my experience, that really does help. So as far as positioning goes, I would recommend repositioning the person that you're caring for every few hours or so, just to alleviate that pressure on that area. Personally, I've seen that small adjustments, even small adjustments, make a big difference. Another approach that I've used, and I do use quite a lot with these cases, are using support services. So things like nice pressure adjusted mattresses and cushions, they tend to help a lot given the right pressure. They do a really good job at alleviating the pressure and helping with the injury. Historically, I've also seen that devices made of specific polyurethane foam, so you can apply on different limbs and just alleviating that pressure and protect it from additional injury. That tends to help a lot. Keeping the skin clean and moisturized is also very important. Increasing the moisturization of the skin, it's been proven to improve the integrity and the strength, but I wouldn't overdo it on moisturizing because that could have the opposite effect. So after clean the skin, apply a reasonable amount of moisturization to the skin and pat it dry nicely just to achieve a nice balance. That should help a lot. And finally, nutrition. Nutrition is essential to good skin health. In addition to specific vitamins, protein is a major key player in building healthy skin and helping with healing. So protein sources like meat and nuts and dairy products, those are really great sources of protein. If there are issues with digesting, then there are also great protein supplementation options out there, like your protein shakes. I would recommend speaking to your provider about the best option for you because there's just so many protein supplementations out there. So talking to them would be great to find the best fit for you based on your medical condition. So what should you do if you do develop a pressure injury? Well, based on what I've seen on how wounds can turn so bad so quickly, I would strongly recommend seeking professional help. They have the tools and just the ability to monitor and assess progress and treat it the way that it should be. Especially in a lot of these cases, advanced treatments are usually necessary, like a procedure called debridement, where in a lot of cases, in order to help with the wound healing, you have to clean off the dead tissue. So first, speak to a specialized professional. The wound is usually first washed with either a normal saline solution or a recommended wound wash. You should avoid hydrogen peroxide solution or similar harsh chemicals like alcohol, because that can just lead to further damage of the tissue. Then usually the appropriate dressing is applied, and there are just so many different types of dressings. based on the stage of the wound and condition the patient is in. So choosing the right dressing is really important to help with wound healing. And an extremely important step is managing the pain. It is so crucial. If it's safe to do so, over-the-counter pain relievers can help a ton. But if the pain is to the point where it's just so severe where the medication doesn't touch it, then talking to your primary care provider is probably going to be the next step to talk about different pain control options. But getting the pain under control is super important just for overall comfort. So before we wrap up, let's talk about some common traps that, in my experience, unfortunately, people tend to fall into, making the wound worse. Do not wait for the symptoms to worsen. Early intervention is so key with these pressure injuries, especially given the fact how quickly they can turn into an even worse stage. If you notice anything, any of those descriptions that I described earlier, just seek medical attention right away. Again, avoiding excess moisture is very important. Too much moisture can lead to what we call maceration of the skin, and that just leads to an increased risk of breakdown and starting that potential cycle of the pressure injuries. So keeping it to that nice level of dryness is super important. Also, ignoring nutritional needs is a common trap. It's just so easy to overlook, but it's so important to proper skin health. So again, getting enough protein in your diet in addition to essential vitamins and nutrients that you might be lacking. So consulting with your healthcare provider and seeing what you might need to put into your diet to help with healing is super important. It makes a big difference. And that's it for today's video. If you found the video helpful, please give a thumbs up. And if you haven't yet, please hit the subscriber button. Also hit that notification bell so you're always up to date on the latest wound tips and tricks. And if you have any additional questions about pressure injuries or other wound care questions, please feel free to drop them in the comments and I'll be sure to cover them in other videos. And don't forget to check out our other content for other great tips. Stay informed and heal well.